Hypertension is a short form for high blood pressure. There are values of measurement before one can say one's blood pressure is high or low. However, blood pressure has been shown to increase mortality, especially among people living with HIV. The Nigerian Institute of Medical Research have therefore donated medical equipment to 30 primary health care to help curb the rate of mortality among those living with HIV in the society. Speaking to journalists at the Research Institute, the medical director, Professor Babatunde Saloko, aired his opinion.
This research is about how to reduce the burden of high blood pressure among people living with HIV. And because we already have a platform in the PHCs where people living with HIV are receiving treatment, they happen to be the largest concentration of this group of people that we now want to study. So we decided to use the Lagos State PHC, train their nurses on how to add to what they are doing the control of blood pressure. And we needed to equip them to be able to do this. So what we are providing for them today are equipment required for the success of that study.
It's a very laudable gesture on the part of the Nigerian Institute of Medical Research for them choosing Lagos to start this research. And beyond the fact that the equipment that have been donated will be used essentially for the research that they are embarking on now, it would also be nice that we'll also be using it for other patients that will be coming to the primary health care center. So indeed, it's supportive and it's an addition to what we already have in the primary health care centers.
In Lagos State, there are over 300 primary health care centers that the government is taking care of, and only 3 of it have been chosen by the Nigerian Medical Research for the work.
So what we are doing with this project is to integrate hypertension care into HIV treatment services. The essence, and they're using tax shifting strategy. The country have adopted the tax shifting strategy in which doctors can tax shift some of their duties to other health workers. So what we are now trying to do now is that at the HIV treatment centers, nurses and the CHOs will identify persons with HIVs who have hypertension, and then manage them using lifestyle modifications, weight reduction, changing their dietary habits. But however, if while they are doing that, those with severe or complicated ones will be referred to the doctor.
What we have witnessed today is monumental. I would say it's a good development, and it has come to us as a good news. You know, because it's like there's now hope, or better hope, that the high mortality rate that the PLHIV have been experiencing for some time will be reduced or will come to an end.
The medical researcher, however, believes that the result or the outcome of the research will go a long way towards improving the healthcare system of the people, especially people living with HIV in Lagos State.